Injectable aesthetic treatments can be amazing in the right hands for the right reasons, but in the wrong conditions, they can create more harm than good. Hi, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon and founder and creator of Karam MD Skin. My specialty is helping people look as young as they feel, and today I'm going to be rating the top 6 injectable treatments that I get asked about literally all the time. And if you like content like this, make sure you subscribe and hit the bell. Now let's talk about injectables, starting with the absolute gold standard. All right, so the absolute gold standard in injectable treatments is the one that's been around the longest, and that is Botox. And remember, Botox belongs to a class called neuromodulators. Now, what do neuromodulators do and why are they so important? Well, neuromodulators affect the way the nerve and the muscle interact with each other, essentially blocking a nerve impulse trying to tell a muscle to move. Now, neuromodulators have been used in anti-aging of the face by decreasing the pattern of mobility that leads a line, for example, in the forehead or in between the eyes, we call them the levens or the crow's feet. All this repetitive motion, raising your forehead, creasing, smiling, etc., begins to leave an impact and an imprint on the skin. And when that happens, a dynamic line, which is there only when you're expressing, eventually turns into a static line. And a static line is basically a wrinkle that's there all the time. The thought is if you decrease the mobility of that muscle, therefore decreasing the impact on the skin, you can prevent a line from becoming a static wrinkle. And this is not just something that's theoretical. It's been shown and tested and studied, oh my God, probably more than anything in aesthetic medicine. I mean, there's literally thousands and thousands of articles. And in fact, a famous study was where they took 2 identical twins. They showed the difference between the 2 identical twins, and lo and behold, one that used Botox for the last 10 or 15 years looked significantly younger, had a lot less lines and wrinkles, especially around their eyes, etc., than the one who did. And not only that, but even during immediate impact, meaning like when you're using it for the 3 or 4 months that it works, you just look a little bit more rested, a little bit more relaxed. And there are ways to do this without overdoing it. And I did an entire video on this showing what areas of the face you can actually treat with Botox, amount of units you should be using, etc. And this was all based on 20 years worth of injections and making my own mistakes along the way. So I give Botox a 10 out of 10. Very safe, again, in the right hands, predictable outcomes, and very, very impactful in terms of the anti-aging process. This is something that I've been doing personally, just a little bit here and there, just around this area, just to decrease the oomph out of the muscle. My wife, Netta, does it. I mean, I generally recommend it for all of my surgical patients. Let's move on to number 2, Sculptra. Sculptra is a biostimulator. It's a fancy way of just simply saying that it stimulates your own collagen production. The cells that make collagen are the fibroblasts. When Sculptra is injected into the tissues, it interacts with the fibroblasts, leading to a signal that stimulates the production of collagen. So this is what's fascinating. L-lactic acid, which is what Sculptra is also found in certain types of sutures. Now, these sutures that we use for surgery, you open up a face for revision or something like that, and you see nests of collagen around the suture. So somehow, again, these sutures were stimulating some of this collagen production. Company decided they're going to take this, granulate it into a powder, then we resuspend it back into a fluid form and then inject it. And when we injected these tiny little particles, and I think of them as almost like fertilizer for collagen producing cells. And when they're injected, they stimulate collagen, and what collagen fundamentally results in is volume. And that's what their whole point of Sculptra is, in my opinion, is to restore volume. Its first indication from the FDA was for HIV lipoatrophy, which was a condition that people that were on HIV treatment meds where they were losing the fat in their face. So they become very, very gaunt and unfortunately create a stigma and an association with these drugs. And it's a beautiful, beautiful thing to have a treatment for these patients where we could stimulate the collagen and build the volume back up. I used to do this for patients through our residency clinic, and it worked. It worked very nicely. And then as the concept of volume became a little bit more important in facial rejuvenation, we started using Sculptra for volume replacement in the aging face. So I give Sculptra a 7 out of 10 in terms of its efficacy. Now, a couple of points here. It is great for a structural support. It's got a long history. It generally takes at least 3 treatments to get the changes that you want, depending on how depleted you are. But usually 1 treatment is not enough. So remember that. One of the most common mistakes that people make is they go get a vial of this stuff and then they quit on it because they don't see any changes. I always think that the first vial is just kind of like ramping up the collagen factory, and then the second and third vial is where you start to see the actual changes. So that expectation is extremely important. But placement is extremely important with this particular product, because what ends up happening is if you inject it near the eyes or the mouth, you could end up getting nodules. And that is not a good thing. Now, I know you can dilute it a lot and do all this I just wouldn't risk it. Temples, mid cheeks, preauricular region, this area around the cheeks, this peripheral part of the face are the best areas for Sculptra, the safest areas, and actually work quite well. My personal favorite area for injection and recommendation is for the temples, and people that have those really, really hollowed out temples, it really works the best because it's the only way to get deep volume into this temporal area and get that structure back in there. A lot of times the volume that we see in these areas is simply because people's faces have fallen and the midface and the jowls are coming down, so it creates a void here. So really for me, bringing this back up surgically is the way to restore that. I don't typically use it for that area, but the temples is a wonderful treatment. Here's another quick caveat. Don't use it if your goal is to lift your face. I think I've beat this horse to death. It is absolutely not going to lift your face. No filler will do that. So Sculptra is going to disappoint you if your idea is you're going to do this to get a facelift type of result. But if you're looking for volume in specific areas of the face that have lost it, it's a good solution. So overall, Sculptra for the right areas, wonderful treatment. I've had a lot of experience doing it. By the way, if you want to see more on the topic of Sculptra, I know this is a hot topic with a lot of different indications out there. Drop your thoughts in the comments and I'll take a look and we can maybe create a video for you guys down the road. All right, so next up, the classic fillers. The big 2 in fillers are Juvederm and restylane. It's like Coke and Pepsi, basically. Similar products. They're both hyaluronic acid fillers, also have been around for a long time, 20 plus years. These are basically volumizers. Now, keep in mind, hyaluronic acid, and you probably have heard me talk about it in relation to skin health and youthful skin, but hyaluronic acid is a naturally occurring product, meaning that your body, your skin, your joints, etc., are constantly building and making hyaluronic acid. Trouble is, it lasts about 24 hours or so, and then it goes away. The companies that design these fillers, what they have done is basically cross-link them into polymers that allow there to be, think of it as like a tree with all the leaves on that tree being hyaluronic acid. Now, hyaluronic acid in this form allows it to stick around. So you're able, I said it lasts 24 hours. Well, in this particular form, it can last 6 months, 9 months, a year. And in some indications, this is all kind of like the negative side of fillers is sometimes because you don't want it to, it can actually last even longer and stick around for a while by avoiding some of the inflammatory process that breaks this down or turning into scar tissue, which then makes it stick around. Now, that's besides the point. The point here is that one of the beautiful things about hyaluronic acid fillers in general is that you have a safety valve, meaning that if it doesn't look right or you don't like it or you run into trouble, let's say, God forbid, it gets injected into a blood vessel and now you have, ischemia, the skin is starting to show signs that it's going to basically die off from filler being injected into the blood vessels that are feeding it. Well, you can inject it with a enzyme, hyaluronidase, that basically dissolves the filler. Or if you get too much of it, you don't like the way it looks, or it's put around an area that gives a little bit too puffy, etc., you can remove it. Now, the problem is if you inject too much of it over time, it gets very difficult to know where the last person injected it or where the person 10 injections ago put it in. So it's not perfect in terms of breaking it down, but is definitely an option to break down this filler, which gives it a level of safety, which is nice. But again, just like Sculptra, it is not we've learned this the hard way of trying this all over and over again. It's not going to lift your face. It might improve some contours in the patients, especially in the 30s and early 40s. Just a little bit of volume goes a long way. It's a nice treatment, but it's not going to solve the laxity problem. So don't use it for that reason. So my overall rating for these fillers is a 6 out of 10, which is a pretty good rating. And again, my reasoning for that is we need to move past this whole liquid facelift concept, which I believe we are, and recognize that hyaluronic acid fillers do have a place, especially for lip augmentation, a little bit under the eyes when you have subtle hollows there. And then again, subtle temporal work. It can work beautifully in addition to Sculptra. Sculptra can go deep, and this one could be a little bit more superficial, creating a bit more balance in the temporal hollows. Now, the danger is filler fatigue. This is where people chase every wrinkle with more volume and end up looking pillowy or overdone looking, or use it for the wrong indications. Like I said, they think they're going to get a facelift with it. And so the key here is that less is more. And look for a provider that tells you no. I used to tell patients all the time. I think it was like a third of my appointments. I don't do fillers anymore, but a third of my appointments that would come in for filler, I literally turned them away because they just didn't need it. And they would be sad a little bit because they were looking forward to doing something. And, but they appreciated my honesty and they appreciated being told not to. You want to find a filler injector that can turn you away when you don't need it. I think the perfect age for these patients are somewhere in the mid to late 30s, early 40s, because that's where a little bit of volume loss is happening and replacing it can look gorgeous. But once you get a little bit older, 50s, 60s, beyond, the sagging becomes too much for these fillers to even show the impact. And then so what people end up doing is just injecting too much filler to try to overcome it, and then they never win that battle. So that's where I would kind of keep in mind. It's kind of a perfect treatment for the younger patient. Now let's talk about products that don't have a safety valve. Radiesse is one of them. Now Radiesse, it is calcium hydroxyapatite, and it also has the potential to stimulate collagen, but that's not really what makes it a choice for a lot of people. It's technically supposed to last a little bit longer, but it doesn't have the ability to attract water the way hyaluronic acid fillers do. So there's a little bit less puffiness to it, a little bit more control. But the problem with it is, and this is why I rarely used it in the face, is if you inject this under the eyes, or if you inject it into the lip, or do some of these areas, and you don't like the way it looks, or if it ends up being funky looking, too much in the cheek, etc., you're stuck with it. It is very difficult to reverse course with a calcium hydroxyapatite filler. We used to do it a lot in the hands, which is one of those areas where you're not going to have to go back and modify. Just a little bit of volume goes a long way. Sometimes deep injections along bone, where you didn't think that there's going to be a lot of thing. But honestly, the HA products, the hyaluronic acid products are just as good for that. So anytime I have a way of reversing, I'd rather do that. It just feels safer to me, especially if you, God forbid, get into a blood vessel, etc. You want a recourse. And so for this reason, I give it a 4 out of 10. Why? Because it's effective, but the big disadvantage that I just mentioned, you can't dissolve it. Here in this case, HAs win as far as I'm concerned over Radiesse. Honestly, there's really no scenario where you need a product like Radiesse over an HA product, except for, like I said, it's a preferential treatment that I like for hand rejuvenation. Next category is PRF and PRP. These are derived from your blood. You take a vial of blood from a blood test, basically in a tube, you spin it down, and then you separate it to the platelets and factors. Now, without getting too deep into the biology, just think of these as growth factors that will help with potentially stimulating your own collagen to some level, subtle, nothing too crazy. And they also help with decreasing inflammation and just all around being kind of like a good thing for your skin. The area that I find it to be most beneficial is when it's used in conjunction with microneedling. This is where you poke little holes in the skin and then you put either PRP or PRF onto the skin and you get some of that extra growth factor, get a little bit more extra boost out of it. But where I have not personally seen a lot of benefit is where it's being used as a volumizer. So in this case, I would give it a 3 out of 10 for that reason. It's too subtle. I mean, it's fine. It's safe. There's no real downside to it, but I don't really see much of a positive impact, again, for volume. But for skin, boost your microneedling with it, no problem. My wife does it from time to time when she's doing microneedling on her neck. I think it's one every 3 or 4 times she does that with PRP on that. But I've heard about it being used for filling under the eyes, etc., that type of stuff, but never heard of it and seen it actually work or last. So in a nutshell, super safe treatment, comes from your own body, just not a volume treatment. Let's talk about the new kids on the block. Number 6 is exosomes. This is an absolutely new generation of biostimulating agents. Think of them as prepackaged little bags of information that tells your cells what to do. And why I say prepackaged, because in order for something to get through the skin in that delicate of a way, it requires essentially dissolve through the skin barrier. Skin barriers are made of lipids. So something has to be enveloped in something that can be transported through the skin in a way that allows it to get inside the cell and then send the signal, send the message. And that's what exosomes are scientifically doing, is they're allowing communication to happen and telling the skin cells or whatever tissue they're being injected into to produce collagen more, to heal that more, to reduce inflammation in this situation. Problem is, at the moment, there are very few real studies on the topic. And there's very few legitimate, basically, labs that are producing this on a commercial level. And for those 2 reasons, my rating for exosomes at this time is 2 out of 10. If I were to order it tomorrow, I don't know what the potency is, what I'm exactly getting. Is it actually living or not living? I mean, I just think about how delicate proteinaceous or genetic material is. There's just too much question. And the more I know, I was a molecular biology major at UCSD, the more you know about this, the more you realize that there's a lot to get right before it can actually be right. So I am waiting for this to get better before I can start recommending it. And the other point about this is whenever you're doing something like this that can have like a cellular impact, right? It was just kind of a big deal. You want to see long-term clinical outcomes. At least I do. I mean, I don't want anything going into me that I don't know. I mean, there's obviously times when you have to kind of bite the bullet and try something experimental, but we have too many great things out there that work really well, from like strong active skincare, retinols, vitamin C, niacinamides, all that stuff that we know work really, really well. I don't really see a point in, going experimental just to improve the quality of your skin. Does that make sense? So for now, we're just going to have to hold on and see what the future holds. But definitely an exciting category. And I know a lot of labs are jumping onto this area. So we'll keep you all posted on the progress there. So I have ranked these based on what generally is the safest and most effective for long-term facial architecture and facial aging. But your anatomy is unique. I see patients literally every day who have been over-injected with the wrong products for the wrong reasons. Really what makes my job as a surgeon much harder when I finally have to do a facelift, and they made the situation much more difficult to operate on. So be mindful that one day you may end up needing a facelift or wanting to have a facelift. And so the less you do to your face to alter it structurally, the better it is for your surgeon. So I hope this has helped you learn what may work best for your specific aesthetic goals. If you want to learn more about my surgical practice and what I do to help rejuvenate our patients, please visit drkaram.com. And if you're interested in learning more about my anti-aging skincare line, visit karammdskin.com. Don't forget to sign up for my Point of View newsletter that I write every single week. This is a free weekly newsletter that comes to your inbox, so make sure you sign up for that. Share this video with someone who could benefit from it. And if you haven't already, make sure you subscribe. And if you have any questions, drop them in the comments below. Thanks again for watching. Until next time, Dr. Amir Karam.